My name is Christopher Starr. I'm an ophthalmologist practicing at the Weill Cornell Medical Center in New York City. I'm a cornea, cataract, and refractive surgery specialist, and I have certainly a special interest in dry eye and ocular surface diseases. That's a great question, and I think there's a generation of eye care providers, optometrists and ophthalmologists who still feel like dry eye disease is a bad word, that there's a stigma around that category of eye disorders, simply because traditionally there has been this dramatic disconnect between signs and symptoms. And a big part of that problem was that was prior to the age of the diagnostic testing that we have now, the luxurious era that we live in of all these specific pointed diagnostic tests, objective tests that take a lot of our guesswork out of the proceedings. And it was an era prior to all this, the modern era, where everything was called dry eye disease. Everything was treated as dry eye disease. And prior to FDA-approved topical medications, prescription medications, Restasis being the very first one, and then a whole slew of others have come since then. Everything was treated with punctal plugs or artificial tears, and those are dry eye treatments. And there's a whole other category of subtypes of ocular surface disease, everything from anterior blepharitis to MGD to conjunctival chalasis to ocular allergy and allergic conjunctivitis to floppy eyelids to corneal disorders and a whole host of things have very different treatments than dry eye disease. They're not dry eye disease. There's neuropathic pain, there's neurotrophic keratitis, and I could go on and on and on. We don't have time, but it behooves all practitioners to try to identify these subtypes of ocular surface disease and then treat them with their specific treatments. And that very quickly eliminates this frustration for both patients and for surgeons and doctors and optometrists and eye care providers. What I find so exciting as a practitioner practicing in this era is that there is just an abundance of innovation. There are things that have been approved in the last few years, which are already out there and we're already using them, but do represent a tremendous step forward in what we're doing in dry eye and ocular surface disease. And then there's a pipeline of various products, everything from diagnostics to treatments to drops to therapeutics to procedural things that have a lot of potential. Hopefully many of these things will be approved by the FDA and in our hands in short time. There are so many things that have just come out. For instance, we just got a new FDA approval for a new category of dry eye called dry eye flares. Dry eye flares is something that we've always kind of dealt with as practitioners, and we have patients who we thought were under good control who came in emergently because they had a flare-up of their symptoms of their dry eye disease or ocular surface disease, and we sort of would treat that often with topical steroids, but that was always off-label. Now we have a recent FDA approval for Isuvis from Cala, and it is a topical steroid drop that is FDA approved for treating dry eye flares. So we've been doing a lot of work around the education with dry eye flares, and I just presented a poster at ARVO on a 10-year literature review of dry eye flares, and there's not a whole lot that's been published in the past, so this is another area where we're going to learn a lot more in the coming months and years. In addition, another recent approval for what I would consider an ocular surface disease is neurotrophic keratitis. We have recombinant human nerve growth factor, or Oxervate is the trade name in the US. And this is, for the first time, an FDA-approved product for treating neurotrophic keratitis and regenerating corneal sensation and corneal nerves and treating the root of neurotrophic keratitis for the first time. So that's a huge things in the pipeline. I think a big category that we're going to be talking a lot about is Demodex mites, Demodex blepharitis. Demodex is something that the prevalence is pretty darn high, especially in older patients, and some studies say it's up to 100% of patients over, say, the age of 70 have the presence of these Demodex mites. And it is a very common source of blepharitis, anterior blepharitis, which is the source of a lot of symptoms for patients. Itching of the eyelids, red, crusty eyelids. We see it under the slit lamp as these little collarettes at the base of the lashes. And this is, as you can imagine, a topic that you don't like to have to discuss. You have mites, little mites in your eyelashes. It's kind of gross and kind of scary, and people tend to flip out, rightfully so. And we don't really have any FDA-approved products right now. We do have some various tack-on treatments that we do with various scrubs and maybe some procedural things in the office and ointments at night, but there's never been an FDA approval, and there is some studies that are fairly far along in phase 3, I believe now, looking at some potential pipeline products for eradicating Demodex, which would be completely revolutionary for the field and would be something that would help us to identify these various subtypes of ocular surface disease, all of which cause symptoms that are construed as dry eye disease. But if you treat it with artificial tears, those mites aren't going to get better, I can tell you that. Another area of recent development is in the area of cosmetics. I have 2 young girls, 11 and 13-year-old girls who have recently discovered makeup and cosmetics, and I see them caking this stuff on their eyelids and their faces. And the cosmetic industry is fairly unregulated, and there's a lot of nasty toxins in some of these cosmetics. And we're looking at young kids starting to use this stuff daily, and you can imagine the long-term toll that some of these toxins will have on their meibomian glands and their ocular surface. And so there is a renewed area and renewed interest in safe cosmetics, eye-friendly cosmetics, and there is a company called Eyes Are the Story that just came out with a whole line of eye-friendly cosmetics that I am trying to now steer my loved ones towards, and certainly all my patients as well, because it can really help to protect the ocular surface, help to maintain ocular surface homeostasis, and very importantly, to help to maintain the health of the meibomian glands, which are so important to healthy oils and a stable tear film.